Hello, I'm Philippa Thomas in London, standing in for Katty Kay.
And I'm Carlos Watson in California.
And welcome to When Katty Met Carlos,
a new podcast that explores how America is reshaping its future. It's brought to you by the BBC World Service and OZY Media. Philippa, it's so good to have you with me this week. I miss Katty, but very pleased to have you.
It's great to be here, Carlos. I'm a listener to your podcast, and it's really an honour to stand in for Katty. I should say we've worked, Katty and I, side by side for years at the BBC, and there was even a point where I moved in Washington and I found I was on her street. So you've got the neighbour.
I love that. Well, what a week you were joining us for. It's Thanksgiving week. It's the week in which the transition from President Trump to President-elect Biden seems to finally be gaining some meaningful, tangible momentum.
Yeah, and you're going into lockdown. We're in England, coming out of one. And we don't have Thanksgiving, of course, but we probably need Thanksgiving because this is also a week in which we can at least give thanks for vaccines. That has been the topic of the moment, hasn't it?
Of course. And needless to say, that brings us to this week's topic, which, of course, is that the COVID-19 pandemic has hit America harder than any other country.
More than 250,000 Americans have now died from COVID-19, and I think it's around 12 million people in the US who have caught the virus.
You know, that brief time at the beginning of the year when everything was normal seems so long ago now, doesn't it? And it's remarkable how much of our lives have been turned upside down since then.
Everything, Carlos, everything. Home life, work life. I mean, everything's been rethought, hasn't it? And in a way, we've been really busy trying to revolutionize our lives. But also, I think, how did we get to November? How has it been so fast?
Yeah, I think it feels for most of us like 2020 can't end soon enough. And in fact, the closer we get to the end of the year, all the familiar holidays and traditions, I think the stranger life feels given the way we're living right now.
I think you're absolutely right. And let's welcome our first guest now to talk about all of this is journalist and author Fareed Zakaria. And he's the author of the new book, 10 Lessons for a Post-Pandemic World. Fareed, welcome to When Katty Met Carlos.
Hi there. How are you?
We're very glad to hear you.
Where are you, by the way?
Though mentally I'm in the States, I'm actually in London.
And Fareed, I'm in Silicon Valley. Are you in New York or where are you?
I'm in New York. My God, this really is, an illustration of the digital life.
Yeah,
it is. Fareed, congratulations on your new book. And you're talking about post-pandemic life, not only in the States, but around the globe. Tell me, as you were doing this book, what has surprised you the most about this pandemic?
I'd highlight two things. One is that it's accelerated life in very dramatic ways. I mean, just think about the use of Zoom or telemedicine, just a dramatic leap forward. We're 10 years ahead of where we thought we'd be in some of these areas. The piece that really surprised me in a kind of negative sense, the sense of foreboding I have about this pandemic, is the degree to which it has really massively widened inequality. So think about us. We're all working pretty much as normal in the sense that we've managed to use these technologies to continue to work. We even are able to socialize. But most importantly, we can continue to generate the same kind of income we were able to do before. For anyone working in a restaurant, a bar, a hotel, a retail mall, a cruise ship, a theme park, for them, this is the Great Depression. And they were low-wage workers anyway. So that widening divide, again accelerated by the pandemic, is probably the thing that I was shocked to look at the numbers and still am worried about what it will mean.
So Fareed, that adds to the worry and the fear, I guess, that people have. When you look at US society, there's not only the concern about could I get it or could my mum and dad get this, it's also it's not fair.
Absolutely. Look, there's the public health aspect to this. There's the economic aspect to it. There's also, let's be honest, a kind of social psychological aspect to it, which we haven't even begun to really plumb, the depths of isolation and despair and those kinds of feelings and real problems. But I think there is a sense in which this feels unfair because it is unfair. It was one thing for businesses to go bust during the global financial crisis. A good number of them had taken on too much debt or they had invested in risky financial products. In this case, you have, restaurants, hotels, bars, small businesses going out of work because of nothing they did. There was no irresponsibility. There was no bad management. So that feeling of helplessness, it's going to be one of the fuels of a kind of transformation of politics. And we don't completely understand where it's going to go, but we can see what the ingredients of that great sense of dislocation and anger come from.
It's so interesting, Fareed, as I hear you say that. So often when we think about anger, at least in the States in recent times, we've thought about some of that anger among some of the supporters of the president who cast a change vote in 2016. But as I hear you say that, I wonder whether that anger could also show up in the politics of the young.
Look, these kind of political shifts take a while to gather steam, and then they manifest themselves in unpredictable ways. So think about the crisis of 08-09, caused largely by the irresponsibility of the private sector, banks and such. It ended up fueling a shift to the right, right? Because it turned out that people got very insecure and very angry. And that insecurity took a form of kind of cultural anxiety, right? In Britain, it took the form of saying, we don't want to be messed up with all these Europeans and, immigrants. In America, again, anti-immigration was a big part of it. So the cultural shift right towards a kind of cultural nationalism and populism was triggered by something that, academics or economists might have said would actually make us all become much more left-wing and believe in big government solutions and distrust the private sector. So who knows where this is going to go?
And one of your lessons, Fareed, is something like listen to the experts, and the experts should listen to the people. So if you do want to counter those, really visceral emotions that people are having, how do you suggest you persuade people to listen to the experts after, all these years where with Brexit, experts have been somewhat scorned, and in Washington, we've been told, well, we're about draining the swamp?
Yeah, this is a really interesting challenge. So one of the reasons I came to that lesson is that I was asking myself, why is it that people are not listening to scientific experts, to medical experts who are telling them to do things like wear masks? And I realized that it was part of this much larger class divide that has grown in the Western world, and particularly, by the way, in the Anglo-American and Anglo-Saxon world, where you have a sense among the less educated and people who perhaps don't live close to big cities, that they are being dominated, bossed around, and condescended to by a set of urban elites who have cosmopolitan values and college credentials. There's a very good article in The Atlantic which pointed out that the great divide in the 2020 election turns out to have been diplomas and density. People who lived in densely populated areas and have diplomas of some kind voted for Biden. People who live in sparsely populated areas and don't have diplomas voted for Trump. And that divide and that resentment is so real. And it's part of a much larger phenomenon of the kind of sorting out of the labor force into, broadly speaking, knowledge workers at the top and people who work with their hands, if you will, at the bottom. That we have to recognize it's not enough to just be an expert and say, trust me, I have a degree from so-and-so place. We have to realize that there is this great sense, this divide, it's a cultural divide, it's a class divide, and we have to empathize. We have to find better ways to communicate. We have to understand that we need to signal a sort of sense of appreciating the dignity of everyone, really, of people who work hard, even if they don't make as much. I think Joe Biden, in a way, represents that kind of politics, where he clearly is. I mean, he's comes from a real elite at this point. He's been in the Senate for decades. He's vice president, but he always communicates a certain empathy and connection. And I think, we need to all be able to do that a little bit better.
Fareed, talk to me a little bit about leadership. I think it's probably easy to say today that President Trump mismanaged the COVID crisis. And it would be easy for people to say that other people have managed it better. But have there been any really superior government leadership on this question? And if so, who would be the top one or two, do you think, in handling this pandemic?
Oh, yes, without any question. The pandemic has been a kind of great revealer. Warren Buffett has this line, only when the tide goes out can you see who is swimming naked. The gold star, without any question, goes to Taiwan. Taiwan is right next to China, as you know. It gets millions of tourists and visitors from there, so very exposed initially. It has 24 million people. It has had under 10 people die of COVID. I think the last number I saw was 7. To give you a sense of how dramatic that is, New York State is about 20 million people. It has 35,000 deaths. So what did Taiwan do right? It acted early, aggressively, and intelligently. And the most important thing was it put in place a kind of testing and tracing regime where you tested people for COVID, and if you found they had it, you isolated them, you did contact tracing, you put all their contacts on notice. And what the vice president of Taiwan, who handled this, told me was, what we did was we took those few people, 1% of the population of Taiwan that was infected or potentially infected, and we monitored them very carefully so that the other 99% could live freely. So Taiwan had no lockdown. So there's no question some people got it right. Some governments got it right. Within the governments that didn't act as well, there is still variation, by the way. New Zealand did do a much better job than, say, Britain and the United States. Germany has done a better job than Britain and the United States. Certainly in the Western world, is varying degrees of ineptitude.
So Fareed, the book is 10 Lessons for a Post-Pandemic World. And just listening to the way you're describing things to us now makes me think a post-pandemic US or a post-pandemic West has to be more humble about learning from others.
It's funny you say that. One of the things I noticed about the countries that have done well is that they all, in some ways, failed and then learned from others. So if you look at Taiwan, one of the reasons I like that example is Taiwan actually did badly with the SARS crisis. South Korea did badly with the MERS crisis. These were other coronaviruses that almost became pandemics 10 years ago. And what they did was they learned from it. They asked themselves, what did we get wrong? How do we revamp our health facilities? You can even more broadly say that if you look at some of the governments that have done well, even in the West, they have had that sense of renewal. Germany obviously, renewed itself after World War II, recognizing it had rather dramatically failed. The countries that have done worst in some ways are the countries with a sense of smugness and a sense that they are special. So I think that the role of humility and learning is so important here.
Fareed, I am taking heart from what you say about human agility. And I think when we get into the post-pandemic world and when we're on top of it, what's the next big challenge?
I think the big challenge is to recognize that this is not the last pandemic and to recognize that this was not a one-off. The first lesson in the book is buckle up. And what I mean by that is we've been living life in a fairly dangerous way. We have been developing our societies in a dangerous way. We crowd out wildlife and then are surprised that wildlife is increasingly coming closer to us and then shedding viruses on us. That's essentially what's happened with bats and coronavirus. We are spewing carbon dioxide into the atmosphere and then surprised that we're getting more heat waves, more droughts, more floods, more storms. So all these things are just risky, and we need to start thinking about a more sustainable way to live. In the book, the metaphor I use is we're driving a very fast race car through uncharted terrain, and we haven't bothered to put airbags or buy insurance or buy shock absorbers or even put on our seat belts, and hence the buckle up metaphor.
Fareed Zakaria, thank you so much for joining us.
It's a pleasure. Thank you so much for having me.
Okay, talking of buckling up, let's turn now to the bumpy road we still have to navigate to get out of the current crisis. The COVID pandemic has divided America, much like our politics. But whichever side of the fence you're on, I think we can agree that one thing we all want is for this to be over ASAP. So how do we get there? Our second guest is someone who may actually have a plan.
Yeah, Dr Nicole Lurie is a professor of medicine, and she was the Assistant Secretary for Preparedness and Response at the US Department of Health. She served for 8 years under President Obama.
Dr. Lurie's job was to prepare for national health emergencies, not unlike the one that we're living through right now. More recently, she was an advisor to Joe Biden's election campaign. Dr. Lurie, what are the priorities for President-elect Biden, and how can he get the pandemic under control here in the United States?
Well, it's great to be with you both. And the first thing to say is that the most important thing right now, I think, is to reach out and build an alliance around the country to help create clear and consistent messaging about COVID, what people need to do to protect themselves, to tamp this down, on the one hand. And on the other hand, he needs to message clearly to Congress, we need to be sure there are funds available for the rest of this response to support the economy and to support people who have been harmed by this economy and need support even to stay home if they're sick.
Dr. Lurie, I love your background, not only as a practicing physician, but someone who, as an assistant secretary in the Obama administration, had a chance to deal with some of the public health threats like H1N1 and Ebola and Zika. What has surprised you the most about the COVID crisis?
Well, I think there are two things that have surprised me. One has been really the absence of leadership from the federal government and some sense that you can just leave states and communities on their own. And so that's been really counterproductive, as has been the level of misinformation that has come from the White House. The other thing that, frankly, has really shocked me from the beginning was the failure to act early. So if the rest of the world had an inkling of this in late December and early January, and many others started to act, the federal government did not.
We've heard about something called the pandemic playbook, introduced, I think, by President Bush, George W. Bush, and developed under President Obama, really giving a blueprint for dealing with these kind of crises. And I'm just wondering what kind of things are in the playbook that Donald Trump could have utilized but didn't.
Well, indeed. And I was involved in providing a fair amount of input into that playbook. And it goes step by step. What you do when there's first an early warning while it's still outside of the U.S., what you do when it comes here, how to get ready. And it includes issues around communication and messaging, around coordinated outreach, then getting the healthcare system ready, managing supply chains, managing testing, allocating supplies fairly, all the way through to standardizing clinical care, which in the U.S. still has not happened. The other thing that the pandemic playbook really did is it laid out the ways in which the U.S. would relate to the rest of the world, both in terms of scientific collaboration and epidemiology, but also in providing humanitarian assistance. And that's another part of the playbook that has been singularly ignored.
Dr. Lurie, who have you learned the most from as you've watched either states deal with this or even other governments deal with the COVID crisis? Who's taught you the most? Who's been the most innovative?
Well, I think that certainly there are a number of countries, look at South Korea, look at Australia, who have done really terrific work in messaging. In the U.S., you've seen some states and some governors do a really nice job. I would point to Governor Cuomo in New York. I would point to the governor of Michigan. I would point to the governor of Ohio, how it is that they lead their states through this, particularly from the messaging perspectives, as well as operationally.
But to put it bluntly, for a lot of Americans and others, actually outside the States, belief in the data, belief in the scientists appears to have been optional?
Well, what we've seen is science under attack and enough confusion and, in some sense, I would say suppression of data. Certainly those trying to lead a public health response, those developing vaccines very much are trying to rely on and lead with the science. Obviously, they are hampered by the level of misinformation.
Dr. Lurie, even if we get to the point, which looks likely, that we'll have a choice of vaccines out there, you're still going to have a public messaging problem, aren't you?
Absolutely. And the world is going to have a public messaging problem. Misinformation, these infodemics, as we call them, have spread around the world with every new disease, with every new vaccine. And while I think we're understanding them better and we're understanding a little bit better how to get ahead of them, they're going to be a fact that we have to deal with.
We hear a lot about, and we hear from anti-vaxxer voices. But I understand that that is a minority. And yet quite a few of the people listening to us might not be anti-vax, but feel worried, feel nervous about vaccines. You have to address that large number of people, don't you?
We do. And it's been very hard to talk to the American people or to people anywhere about vaccines and their risks and their safety when vaccines haven't existed yet. So let's recognize that challenge. But I think what's really important at this point is to start creating a level of what I would call vaccine literacy, helping people understand what vaccines are, how they work, how they're made, how they're tested, and then with reference to these specific vaccines for COVID. It's also the case, quite honestly, that much of the clinical community at this point, doctors, nurses, pharmacists, people who not only will be frontline for getting the vaccine, but are the people who recommend vaccines to their patients, for them to understand about these vaccines and for us to listen to their questions and concerns and to address them. You know, there's an awful lot of talking at people instead of talking with people. I can also tell you as a practicing clinician that I often have to sit and listen to many, many questions and concerns, even about things like flu vaccine. And it can sometimes take 15 or so minutes to talk this through with somebody to the point that they're willing to accept vaccine. And this is just the work that we're going to have to do in every community around the country and in every community around the world.
Dr. Lurie, take me forward, if you will, not just in the next year, but over the next decade. Are there any silver linings? I hate to ask that given how many people have died and how much damage has been done. But if I did try to find any silver linings, any positive turning points, what should we hope for? What is possible?
Well, what I think I would hope for and is possible is a global commitment to act as one world, to do good surveillance, to share information quickly. The scientific collaboration that we've seen around COVID has been really dramatic. It's very much my hope with new leadership in the White House that the U.S. will rejoin the international community in meaningful ways, including an enhanced scientific and public health collaboration. I also hope that the world will figure out that it needs a financing scheme for the next pandemic. We're struggling right now to pull together the funds to manufacture enough vaccine and buy it for the world. One shouldn't be passing a tin cup in the middle of a pandemic. We ought to have worked out a financing scheme for the world before the next one.
Dr. Lurie, finally, Thanksgiving's upon us, and I know for so many people in the past in the U.S., it's been a time of gathering with family and celebration. Often people have traveled, and yet there's so much risk to doing so this year. Would you mind sharing a little bit about your own experience, maybe both personally and how you, as a physician and public health expert, how you're thinking about how you hope the country will deal with this Thanksgiving?
Well, sure. It's always easy as a physician or a health professional or somebody else to make recommendations for other people about things that are hard to do. It's hard to make those recommendations for yourself. And so I've really, really agonized this Thanksgiving about whether to get together in a moderate-sized family gathering with my mom and siblings and nieces and nephews. And at the end of the day, I had to make the decision that it really wasn't safe. And so I've stayed home. I'll talk to them by phone and on FaceTime, and we will all get together at another time, I hope, in the near future.
Well, I hope you do, and I hope you have a wonderful and as safe a Thanksgiving as you can. And Dr. Lurie, we're grateful for you joining us on When Katty Met Carlos.
Terrific. Thanks so much for having me.
Great. Philippa, and thank you for joining me this week. Couple of interesting conversations, huh?
Really fascinating. And I was struck, Carlos, by both of our expert guests talking about how important it is to talk with people about COVID, not to condescend, not to patronize.
Indeed. I think that was an interesting piece of it as well. One of the things that really grabbed me was Fareed Zakaria's mention of Taiwan having unusual success. That is not a name or a country that I had heard highlighted previously, and so it was interesting to hear that distinction. Also to hear Dr. Lurie reference Ohio, among other places, who perhaps have been particularly innovative.
Yeah, actually quite heartening to hear both of them talk about good practice, good role models, good practice, because it's quite easy, isn't it, in a difficult time like this, just to criticize and just to kind of take people down, but worth recognizing where people have got it right. And I think Fareed said about Taiwan, they learned from earlier mistakes, they learned from earlier diseases, and they got it right this time.
Indeed, indeed. Philippa, well, this is Thanksgiving week, and I know you're no longer in the States, but when you were here, did you take advantage of all of the American custom?
Oh, I love Thanksgiving. I so miss living in the States, Carlos. We used to, because we were journalists on assignment living in DC, we used to say at Thanksgiving, right, open house. Anybody who's kind of, over from another country, in the bureau for a few days, come round, come over. And it was like we used to have temporary families all getting together because we were all away from home. So I love Thanksgiving.
All sorts of delicious food, maybe a chance to binge a good TV show or three. And next time you're over in the States in healthier times, maybe you and your family will stop by the Watson household.
Well, that would be lovely. I'll remember you said that. Thank you very much.
Thank you.
Well, we hope you've enjoyed this episode of When Katty Met Carlos with me, Philippa Thomas. It's a co-production from the BBC World Service
and OZY Media. And if you've enjoyed this podcast, please write a review, tell a friend, and of course, don't forget to subscribe. Thank you, and we'll see you again next week.